Due to the wonders of technology, I'm starting digitally this morning. I'm sorry I can't be with you immediately, but I have something in Oxford on Sunday evening. But let's start. The future is not like Scafell. It's more like the Manchester Ship Canal. It's not something we arrive at and climb. It's something we imagine, design and build. If you don't imagine, design and build it, other people will. The objective of today is to imagine, design and build the public health service that relates to healthcare. Not the whole of public health, we're going to focus more on healthcare at the moment. And of course, there are many changes taking place. I spoke last night to Yvonne Doyle. Yvonne Doyle is leading the work within Public Health England on workforce. Alison Hill, who works for Solutions for Public Health, and Jenny Wright, from the QUIP programme, we've commissioned them to carry out a Delphi exercise into what is the contribution and what is the workforce for better healthcare, public health. As you probably know, Paul Edmondson Jones, the Director of Public Health for Portsmouth, is leading a group within the Department of Health looking at this. So this will complement that group. But Alison's work will focus very much on knowledge and skills, and that's why this day will be very important in feeding into that. So as we go through the day, we're going to do a number of exercises. We're going to imagine and design what the NHS will be like in the next 10 years, how it's going to be different. And I'll do that exercise with you. Secondly, we're going to look at ways in which public health could make an input to the new NHS. People like you, for a population of 2.4 million. That's a good population size actually. It's the size, it's almost as big as New Zealand. It's about the size of Wales. It's a good population size to work on because it's got almost every type of health service in it. Then we'll look at the types of knowledge and skills that professionals should have, public health professionals should have, and what you see is a gap between where you are at the moment and where you need to be. And then we'll think of ways of closing that gap. My feeling is that you've got the resources that are needed. The world is very uncertain. My own approach in this is to make the maximum use of uncertainty. You may feel in a weak position. My principle has been, in a position of weakness, go for broke. Let's describe very clearly what the public health professional can offer to better healthcare. So that's the objective of the day's work, as the chair has told you already. Now let's start. Let's look at the future. One of the great phrases about the future is that the future is here, it's just not evenly distributed. So you're in a fortunate position that you're able to see the future. I once said to a GP, what's your 5-year objective? And he said, 5 o'clock this afternoon, that's my only bloody objective. There's hand-to-hand combat for clinicians. So we're going to start building a picture now, and the first picture is not of the health service, but of the health needs of the population. The health needs of the population. Now what is a need? The definition of need that I'm going to use in the healthcare context is a need is a health problem for which there's an effective intervention. And of course the word effective is up for debate as well, as you'll see when we look at the glossary of key terms. Now what I've got, and this will be handed around the tables, is a list of the programme budgets. There are about 23 programme budgets. They're based on the International Classification of Diseases. To these I've added a number of programmes that focus on populations. For example, frail elderly people with multiple diagnoses, children. So it comes to, I think, 28 programmes. What I'd like you to do, and this will probably take about 10 minutes or so, what I'd like you to do is to take that paper and arrange yourself in whatever way you want, in threes perhaps, and for each of the programme budgets, identify, firstly, how need will increase. Population ageing, for example. You can probably put that as a tick in everything apart from children and young people. New technology. new drugs, things you see happening that are going to be different. Secondly, in that column, you also start to make notes about how need could be reduced, obviously by prevention. But it may be need can be reduced by service organisation. For example, in end-of-life care, by developing good domiciliary services and by ensuring that people are asked about their preferences before the end-of-life phase arrives, then the need for hospital care can be reduced. You'll also see there's a third column in that sheet, and it's got two little pound signs in it. So I'd like you to write down, don't show too much to your neighbours. Remember that way we used to write behind the hand at school? Write down how many £1 million you think were spent on that particular programme in Cheshire and Merseyside in last year. To the nearest 50 million. We only know really by the disease categories because that's the way the programme budgets are calculated. So I don't know for how much is spent in children. You may just want to make an estimate, and remember you can double count. So some of the expenditure on cardiovascular disease, we can put the same amount of money in frail elderly people, because that's starting to give you knowledge. Healthcare is a knowledge business. I've got a lovely quote from the president of Toyota, that Toyota is a knowledge business. So we're going to start assembling the knowledge now. The next exercise will be to start to think how the health service itself is evolving, but let's look at the population, let's identify their needs. Oh, and by the way, I haven't put a column in, but do you know how many people there are with musculoskeletal problems in Cheshire and Merseyside? Because that's also very powerful information. So I look forward to seeing you soon. Good luck to the exercise. The sheet will be given to the table, and I've given a crib sheet to Paul, but only to Paul, with the figures on for programme budgeting. See you soon.